Can you really have syphilis without any symptoms, and why does it go unnoticed? Yes, one can have syphilis without any symptoms, and the reason is that once the bug enters the body, it can go into hiding. It occasionally shows symptoms, but sometimes it's just so clever that it just hides the immune system. That's why there's no response. That's how it goes unnoticed. How long can someone have syphilis without any symptoms? It can be a long time. Sometimes it can be any time between 2 weeks to 3 months, but sometimes it can go on for many, many years. And that's the reason that you should get tested. What common symptoms of syphilis do people overlook? Well, because syphilis causes these little bumps or ulcers that are painless, if they are in an area which you don't often examine, that's when you may miss it. The problem with those bumps are they are painless, so if you don't see it, you wouldn't know it's there. So most common symptoms that's even often overlooked is an ulcer or a bump or a lump. How is syphilis transmitted? Syphilis is a sexually transmitted infection, which means it can be transmitted through sex. And I have to emphasize that's any form of sex. It could be oral sex, anal sex, vaginal sex. It is really important to note that about a third of cases of syphilis are transmitted through oral sex. Can syphilis be misdiagnosed as any other condition? Yes, absolutely. Syphilis is known as the great mimic. It can pretend and masquerade as any other condition, and this is often the case when people who are not trained in sexual health or have not seen many cases of syphilis forget to test for it. So come back to my first point, you have to test for syphilis to know it's there. Can syphilis cause damage to your body even if you don't have any symptoms? Unfortunately, yes. Even if you don't have any symptoms, it doesn't mean that the bug has gone to sleep. It's still doing its mischief in the body. So you have to get tested to know it's there, to get it treated as soon as possible. When should I worry about syphilis and get tested? Well, first of all, if you have symptoms, go and see a sexual health specialist. Symptoms can be variable, can be a lump, a bump, an ulcer, or a rash. But even if you don't have symptoms, depends on your sexual practices. I suggest getting tested anytime between 4 times a year to once a year. That's the best way to keep safe.